There is much panic and disruption over the consumption of cough syrups. What to consume, what not to consume, what are the formulations that are okay, what formulations are not okay, are cough syrups banned altogether? To answer all of these questions, we're being joined by the head of pediatrician at AIIMS Delhi, Dr. Pankaj Hari. Thank you for speaking to NDTV, Doctor. Doctor, first off, please debunk all of this panic for us. Are cough syrups safe? If yes, then what are the kinds that can be consumed?
Okay, so let me clarify that the cough syrups in older children are absolutely safe. They can be used when indicated and in the right doses prescribed by a pediatrician. So what is generally advised is not to use them in younger children less than 2 years of age, because there is a risk of overdose, and also that the efficacy of these cough syrups has not been proven in very young children.
Right. So what are the formulations or what cough syrups would you certify as okay, I would prescribe this to my patients?
Okay, so if you have running nose and you need a decongestant, then you can use chlorpheniramine or phenylephrine based cough syrup. They are effective in as a decongestant. And if you have very distressing dry cough, then one can even use dextromethorphan in older children, and as it is used in adults also. So there it can be safely used in the right doses. Mm-hmm. So these are two different kind of substances which are there in cough syrups.
Doctor, these three chemicals or formulations that you just mentioned have also, gotten about concerns about them. Please, clarify for our viewers, are dextromorphine or the chemicals that you mentioned, are they safe to consume in a cough syrup?
Yes, so see, if you are using dextromethorphan, chlorpheniramine or phenylephrine, at best if whenever there is an overdose, they can cause sedation. But they will not kill a patient, they will not cause kidney failure, they do not cause profound encephalopathy, irreversible encephalopathy. Like these children, the recent reports have come up that some of these children developed this. And this is most likely because of a contaminant which is there in these syrups, which is diethylene glycol, which is deliberately or inadvertently been used by the drug manufacturers. As a cheaper alternative, people use diethylene glycol instead of propylene glycol, which is the toxin that can cause kidney failure and severe encephalopathy. And previously, this has been reported even with paracetamol syrups. So that doesn't mean that we stop consuming paracetamol. Ideal thing is for the drug regulators that they should look at the formulations and the composition and the constituents of it, and if there are any toxic substances in them, they should be there should be regulation on them.
Regulation, right.
Yes, and there should be severe penalty for this whenever you pick up such kind of instances.
So clearly here Dr. Hari is talking about regulation and penalty also with respect to any sort of contamination. We know that the contamination percentage that was found in these cough syrups was up to 46 to 48%. As per you, what is the safely permissible limit of DEG?
So DEG should not be there in these compounds. So there is nothing like a safe limit. The compound actually is propylene glycol and not diethylene glycol. So diethylene glycol should not be there. So any amount which is there is not permissible.
Right. So as Dr. Hari clearly tells us here that DEG should not, whatever the component, whatever the measure may be, it does not have any place in medicines. Now, for our viewers, especially for parents that are watching, what should one look for in the, say, ingredients or the formulation list when buying a cough syrup? What are the things that one should keep in mind?
So the first thing is that you should not be buying the cough syrups over the counter. So ideal is that it should be prescribed by a pediatrician or a physician, and that should be the only one which should be bought. And you see, you cannot figure out whether your syrup, if it is contaminated by diethylene glycol, you can't make it out by looking at the syrup. So it only can be done after testing. So that the role is not of the parents to find out whether this is contaminated syrup or not. It's the role of the regulatory bodies to find out whether batches are contaminated or not.
What is a safe dosage of cough syrups for children or even for adults?
So we prescribe cough syrup, these medications which are there in cough syrup as milligram per kg. So a pediatrician knows that a particular drug has to be prescribed as per the body weight of the child, and cannot be a blanket dose for everybody.
Right, so it depends on the body weight of the person.
Yes.
Right. Also, doctor, what are other cough relief alternatives?
So there can be several which can be used. There are home remedies. You can use honey. You can use if you have congested, no nasal congestion. You can use normal saline drops which do not contain any medication. So they can be used as an alternative to these symptoms.
With respect to cough syrup formulation and also prescription, what are some do's and don'ts?
So the first thing, as I said, when cough syrup, do not buy it over the counter, and only buy the ones which has been prescribed by the doctor, and in the right doses. So you have to check these three things: that the dose should be right, so to avoid any overdose, and the right compound should be bought, and it should only be based on the prescription and not bought over the counter.
Right. Thank you for speaking to NDTV, doctor. So that was the head of pediatrician at AIIMS Delhi telling us that, cough syrups, it's not like you cannot buy them. It should be bought with respect to prescription and not over the counter, and keeping in mind what kind of cough is it that you're looking to get treated. As doctor mentioned, there are 3 different kinds of coughs, and all 3 have different formulation of medicine that caters to them. With camera person Dharmendra, this is Tanushka Datta for NDTV.